All right, Salim Razai here, and I promised some videos for some chest x-rays I recently released on social media. And so the title of this one is What's Going On in This Chest X-Ray? So this is a 56-year-old female who presents with shortness of breath and respiratory distress. And to be fair, this is not an emergency medicine patient. This is a patient up in the ICU. And this is the chest x-ray that's gotten, and you can see that there's almost clear whiteout on the left side of the chest x-ray. And so the question is, what's going on here? So what I've done here is I've zoomed in on this chest x-ray, and I want to point out two things specifically that kind of help tell us what is going on here. So the first thing is, if you look at the trachea, it is actually shifted toward the site of whiteout, not away from the side of whiteout. And the second thing, and you have to look really closely at this, and obviously this is going to be a little bit harder when you're taking a picture of a picture, but I'll zoom in right here and you can see that there's this cutoff in the bronchus. And this is pretty common when you have mucus plugging, and that's exactly what this patient had. And so we actually did a bronchoscopy, and once we did the bronchoscopy, you can see that there's better aeration on the x-ray on the right, and that the trachea is more midline and not being pulled over to the left. Now, the mistake here and the teaching point from this case is that, is this a mucus plug or is this a pleural effusion? And with mucus plugging, you'll get the trachea to pull over toward the side of whiteout, and the treatment for that is bronchoscopy. With a pleural effusion, what you'll see is the trachea and the mediastinum pushed away from the side of whiteout, and the treatment for this is thoracentesis. And the reason this is so important is that if you look at this mucus plug and you think pleural effusion, and then you go just stick a needle in there, you're actually treating what's going on the wrong way. So there you go. That's what's going on in this chest x-ray. This was a patient who ended up having a mucus plug in their left bronchus that we ended up sucking out. And so the teaching point here is pleural effusion versus mucus plugging. Know what are the things you're looking for on the chest x-ray. Let me know what your thoughts and comments are, and until next time.